will see self-funded retirees pay more and increase support for older Australians choosing to stay at home.
To discuss, let's bring in the Chief Executive of COTA, Patricia Sparrow, in Melbourne now. Patricia, thanks for your time this morning. Now, we know reform has been much needed in this sector. These changes have been described as the biggest improvement to aged care in 30 years. Do you agree?
Good morning. Look, there's really significant reform in this package and really important reform. We know that most older people want to stay living at home and the government's investing so that people can. And of course, the Aged Care Act that was introduced into Parliament yesterday is the response to the #1 recommendation from the Royal Commission into the quality and safety of aged care, which is that the Act be based on rights and focus on older people rather than on the funding arrangements between government and service providers. And this Act does that.
All right, Patricia, as you know, I'm not the sharpest tool in the shed, but I watched the announcement yesterday and the stories on 9 with Charles last night, and I found some of it, the detail of it, a lot. And I watched it with Mum, and Mum didn't quite understand it all. Is that going to be part of your issue here?
Look, the detail is a lot, and I do understand people find it confusing. It's a lot because it's based on your income and your assets, but also on the services that you receive. So we do have to find ways of being able to talk about this in a way that's more understandable for people. We're still analysing all of the detail. We do understand that there will be calculators, etc., for people, so you can put your own situation in and see what that will mean. Also, another good thing here, particularly in home care, is that the pension test will be used. So people who've already been assessed for the pension will have already provided a lot of the information. It should make it more straightforward to work out what it is that you're going to pay.
When will it come into effect? I mean, to Carl's point, there is still a lot that needs to be worked out before the contributions start coming into place and people do start to, I guess, fork out more for their care.
So 1st of July is when new people entering residential or home care will have the new fees regime. But it's really important to know that what government has done is that if you're already in residential care or you're already receiving a home care package or you're on the waiting list and have been approved for a package, these changes to fees won't impact you at all. So it does give time for the new fee regime to settle, and it protects people who are currently in the system from paying more.
I think the support at home package is really great in principle. Sarah and I were talking about this before we came on the show today. Is there a concern that it could be rorted in some way?
I think that what government's doing here is trying to, firstly, as we said, acknowledge that people want to live at home. I don't think there can be rorting in the same way, but that's something that we need to look at. There'll be a list of the sorts of services you can have under the package and the sorts of services that you can't. And so I do think that some of the regulation that will come in around support at home will protect more against that. It's also good to see in the support at home package that there'll be more levels of care. So at the moment, you can get 4 different types of home care packages and, you know, you're kind of chucked into a box, if you like, and you get that amount of money. There will now be 8, so it should be able to be more tailored to you. And at the top end, the funding is more than what you can currently get. So people will get more support at home. Plus, they have 2 short-term supports for people that have been bugbears, I guess, in the system. So if you've been in hospital and you need a little bit more support to recover and be able to live at home, you'll be able to get 12 weeks rather than 8 weeks of what's called restorative care. And that's really important because people sometimes need more. And if you're in the last 3 years of your life and you want to die at home, which most people do, but unfortunately most people end up in hospital or somewhere else, there's an additional $25,000 that you can access to help you do that. So these are important things that older people have said are important to them.
All right, that's great detail, and we anticipate more as well. Thank you so much. Appreciate it. Well, the latest on that traffic situation in Sydney's West coming up.